So PFS to me is, after this, I think it's become more meaningful to me as an oncologist.
Yeah. No, I hear you. And interestingly enough, if we think about it, like PFS is easy to interpret because either bigger or smaller, it's very easy to really, and it's nice to tell it to the patient. As you remember, when I started kind of like introducing the study, I kind of like paused for about 11 seconds, and I did it on purpose because I wanted to celebrate first very important subject for ASCO this year, which is patient-related outcome. And as we all know, this is really the time for us to interrupt the patient after we tell them about the progression, which is sadly very short time, but that silence of it is really too long. And fascinating that patients really value the input of a PFS. And I have to say that on the other hand, at least from my view, OS is a little bit more difficult to really interpret. As one patient said, like, I was talking about OS and I'm like really kind of altogether. I said, I don't get me sound like, what's OS?
I think one thing to keep in mind though with PFS, I mean, PFS is a whole debate discussion we can have. Right. There's a clear, I think in one of the articles, probably some element of informative censoring in the PFS, right?
Fair.
People that are basically coming off because of toxicity that are going to be censored and will never reach that endpoint. Right. So all that data is accumulating and you're not going to mature from that perspective. So I think that's an important thing to recognize if there are toxic treatments. The other thing that to me is always very interesting when you have sort of PFS and OS discussions is, I'm fascinated I'm fascinated by the lack of more detailed discussion on the post-progression stuff. I mean, these patients are getting all sorts of different treatments, and if you really dig in and do the math, I mean, it's really, I'm really amazed that there aren't like really detailed analyses of everything they are getting, because we just assume it's the same and we assume it's right, but I assure you it's not the same. So we should really look at that in more detail.